The nurse strategy for responding to a person's emotional concerns. Health professionals are often unsure of how to sensitively acknowledge or respond to a person's feelings and emotions, particularly around difficult news discussions when emotions can be heightened. A useful approach is to use the nurse strategy: naming, understanding, respecting, supporting, and exploring. This approach will be helpful to provide supportive and non-judgmental responses to a patient's emotions. This strategy involves seeking to understand, accept, acknowledge and respect the patient's perspective, without needing to provide assurance, solve their problems, or feeling compelled to reduce the person's distress. Firstly, naming. In this step, you name the emotion by tentatively making it into a question, so the person can correct any misunderstanding. Examples of this include saying things like, "It sounds like you may be feeling pretty disappointed. I wonder if you are feeling a bit angry right now. I'm sensing that you are worried. Is that so?" Next, understanding. Here, you check and convey your understanding. Be sure to make empathetic statements. For example, "Am I right in saying you would prefer to delay the next appointment because coming in sooner would just be too difficult to manage?" Or, "I can see why it would be helpful given how much you are juggling at the moment." Respect or praise. In this step, you use your words or non-verbal methods to convey your admiration or respect for the person. Here, you could use something like, "I can see you've really been trying to follow the recommendations to the T," or "You've done a great job with this. I am really impressed by your determination." In supporting, it is important to provide statements that indicate your availability and support to the person. Ensure that you emphasize partnership with the person. For example, "I'm going to do all I can for you," or "I'm here, just get in touch if you need." In the final step, exploring, seek further understanding of the person. Seek clarification using the ask approach. The tell me more strategies are also useful here, where you can extract "tell me more about yourself" information by using statements like, "I'm interested in hearing more about." Remember that you do not have to use these nurse skills in any particular order in your conversations with patients. Together, the nurse strategy can be used for identifying, prompting, exploring, and responding to a patient's emotions.